Imagine you visit your doctor to get your mammogram results. There, in the doctor's office, they tell you that you may have breast cancer. What do you mean may have, you ask? Don't you know for sure? Not yet, the doctor responds. He then shows you the mammogram results. We fed your results into an AI model, he tells you, and it thinks you may have a cancerous lump where it's highlighted in red. It could be right, but it could also be nothing. You're not a medical expert. All you see is a white blur. So you ask, well, why does it think that? I don't know, the doctor replies. What do you mean? Don't you know how it works? No, I don't. So you have no idea how it works or why it's saying I have cancer? No. Imagine how frustrating that would be for you. Your doctor, this person who went to medical school for almost a decade, is asking for medical advice from an AI he knows nothing about. And it's equally frustrating for the doctor too. Many studies show that people don't trust artificial intelligence, especially in the healthcare sector, even though statistically it performs better than some doctors. I mean, it makes sense. Imagine you ask your mechanic how he fixed your car and he can't tell you. Other than maybe a magician, if someone can't tell you how they completed a task, you're not going to trust that they did it right, no matter how good they were. And when something like your health or your life is on the line, it becomes that much harder to put your faith in an algorithm. But put yourself in the doctor's shoes for a minute. On one hand, you can use an AI model you know is better than most doctors to help you with your diagnosis and lie about it to your patients so that they feel more comfortable, which is highly unethical. Or you don't use an AI model at all and use your judgment, which is more reliable but possibly less accurate. Artificial intelligence clearly has the potential to improve the healthcare industry, but in its current state, it might be doing more harm than good by making people lose trust in the medical professionals that they visit so often. Which is why explainable AI has become such a necessity in the modern era. Explainable AI is exactly what it sounds like. It refers to methods and techniques in the field of artificial intelligence that provide human understandable explanations of how AI models make their decisions or predictions. And that is the topic for our team's data intensive engineering course, developing an explainable AI for medical imaging. For our approach, we're using texture analysis. We, as humans, can often tell how something is going to feel when we touch it, just by looking at it. The intuition serves as the basis for texture analysis. Images contain a lot of information about the objects they contain, their color, shape, relative size, and of course, texture. Texture can tell us a lot about an object. It can also be used to differentiate between two similar looking objects. This can be very useful in medical imaging, where two different things might look similar to the naked eye, for example, cancer cells and regular cells, but their underlying texture might be different enough to identify the cancer cells separately. We're trying to apply texture analysis to the AI model trained on medical images. By analyzing the core components of the model using loss masks and texture energy measures, we can pinpoint exactly what parts of the image the model is focusing on and what information it uses to make its prediction. So far, we've trained multiple AI models to detect cancer in mammography images, and we've extracted and visualized their features to get a better understanding of how each layer processes its input and what features are focused on and ignored while generating the output. So far, we've been able to extract important information from these models, showing that texture analysis could be a viable approach for explaining AI. However, we're still working on generating human understandable explanation from these observations. If successful, this technique could revolutionize the healthcare industry, allowing both doctors and patients to have more confidence in artificial intelligence and its applications in the medical field, while also giving us more insight into the probabilistic methods used in AI, allowing us to potentially develop better models and even demystify the black box nature of artificial intelligence that's ubiquitous in the current technological landscape.